welcome to the third evening of the 5th Annual Equine Industry Symposium. First held in 2016, the Equine Industry Symposium is an educational marketing and outreach tool used to engage all sectors of the equine industry and connect us through topics of common ground. My name is Rachel Chater. I am a second-year student in the Bachelor of Bioresource Management program, majoring in equine management at the University of Guelph. And I will be your MC for tonight's event. Accompanying me in hosting tonight's event are my colleagues Grace Boyd, Erin McBrien, Mary Margiotta, and Olivia Vicentin, who are also all second-year students majoring in equine management. This week's symposium is hosted by the University of Guelph, partnered with Ontario Equestrian and Equestrian Canada. For those joining us for the first time tonight, this year's symposium topic is resilience, rethinking, restructuring, and reevaluating due to COVID-19. On Monday, our panelists discussed pandemic impacts on various sectors of the equine community, creating a perfect segue into yesterday's topic of discussion, restructuring the business for success after the experience of COVID-19, leading us to this evening's topic of the pandemic pressures on the welfare of equid species. I would like to thank our three speakers for being live with us this evening, even with some time difference. For some, Gayle Ecker, Dr. Roly Owers, and Dr. Bettina Bobsien are all passionate and experts in their field, and we are thrilled to hear what they have to contribute to this evening's topic. After all three speakers have shared, there will be a short question and answer session for participants to ask questions that they may have or that have arisen during the presentations. Through the entire duration of tonight's session, we would like to promote the importance of proper netiquette. We ask that all attendees' cameras remain turned off and all microphones are muted for the entire evening. As mentioned before, there will be time for questions at the end of all the speakers' presentations. We will ask you to submit questions using the question and answer icon located at the bottom of your screen. My colleague Erin will ask the questions to the speakers on your behalf. For those of you that are unable to join the event live evening, all evening sessions will be recorded and made available to view on the Equine Guelph Horse Portal at a later date. This year's unforeseen effects of COVID-19 have not been easy for anyone, affecting some more than others. Prior to COVID-19, many struggled with the understanding of equine welfare. This topic has raised during last evening's session, and it is obvious that it is on people's minds. Tonight's presenters will be able to provide some insight on these concerns. This being said, we hope this evening will educate and activate the movement towards the understanding and proper implementation of equine welfare. We hope that the information shared with you this evening will affect everyone in one way or another, and over time assist in the improvement of the industry. Now to introduce our first speaker of the evening, Gayle Ecker. Gayle is the director of Equine Guelph and played an instrumental role in the birth and the ongoing development as a center for the horse owner at the University of Guelph. She has dedicated her energies to advancing the equine industry through education and communication on health, welfare, and safety. Gayle continues her work on a pyramid of education model, an educational approach that provides learning pathways for career development at all levels in the equine industry. In collaboration with the Office of Open Learning at the University of Guelph, Gayle developed the Equine Studies program targeted to the equine industry to provide over 20 online courses that can be combined for business, science, and welfare certificates, or an equine studies diploma. Gayle is the current instructor for gut health and colic prevention and horse care and welfare. I would like to hand it over to Gayle Ecker to educate us on the Equine Code of Practice and give a brief provincial update.
So welcome everyone. Glad you've joined us here tonight, and really pleased to be here and to be part of this. So what I'm going to be talking about is the Code of Practice for the care and handling of equines. And this is basically our standard of care for Canada. So for those of you who are joining us from other countries, it may be very different than what you're seeing, but for all the Canadians here, this is now our new standard. So I'll first be doing an introduction to the code, and it's called the Canadian Equine Code of Practice for the Care and Handling of Equines, and it does include donkeys. And I will talk about some history leading to its development, and then a few of the new aspects of horse care that are included in this code. So I've already had an introduction, but thank you for that. So I'll just skip by this one. All right, pop quiz for everybody. Just think about this. If I asked you true or false, good health equals good welfare. True or false, good health equals good welfare. The answer to that should be false, but many people will say that that would be true. However, a healthy horse can actually suffer from compromised welfare. So when we're talking about welfare, we're talking more than just absence of disease or absence of pain. So what is animal welfare? You're going to hear a couple of different versions of this, so there is no one defining definition here. But the AVMA talks about animal welfare as an animal is in good state of health, or sorry, good state of welfare if it is healthy, comfortable, well-nourished, safe, and able to express innate behavior, and if it is not suffering from unpleasant states such as pain, fear, and distress. So part of it with a domestic horse is how is it coping with its living conditions? And what we want to try and reach for is quality of life. And so that includes physical health and the feelings they experience. So it's thriving, not merely surviving. So a bit of history on this. Where did this all begin? In 1635, there was a legislation passed that was called an Act Against Plowing by the Tail and Pulling the Wool Off Living Sheep. And that was passed by the Irish government. And as far as I know, that's the first piece of legislation to prevent unnecessary cruel practices for horses and for sheep. And then in 1877, there was a story about a horse. I'm sure a lot of you have read this book. Anna Sewell wrote Black Beauty, and she wrote it from the horse's perspective. And it was the story of the abuse and harsh treatment that she commonly saw for working horses. According to Amazon, it has become the best-selling book of all time. And I'm sure many of us have read it several times. And it had enormous impact on the public perception of working horses. Following that, in 1964, an animal welfare advocate by the name of Ruth Harrison wrote a book that she called Animal Machines. And in it, she was describing the intensive livestock and poultry farming practices, and it exposed that reality of the intensive farming. And it really shocked the nation. So there was a huge amount of uproar about this. As a result of that, in 1965, Professor Roger Bramble led an investigation into welfare of farmed animals in Britain. And as a result of that investigation, he came up with the Bramble Report, which reviewed the welfare for both physical and mental state. That was a big step forward. So then in July of 1979, the Farm Animal Welfare Council developed what's called the 5 Freedoms, and they became internationally adopted. So what are those 5 freedoms? Just very quickly, freedom from hunger or thirst. So that's ready access to fresh water and a diet to maintain full health and vigor. It's the freedom from discomfort. It's providing the appropriate environment, including shelter and comfortable resting areas. Third is freedom from pain, injury, or disease, and doing that by prevention or rapid diagnosis and treatment. Freedom to express most normal behaviors by providing sufficient space, proper facilities, and company of the animal's own kind. And the final one, freedom from fear and distress by ensuring conditions and treatment which avoid mental suffering. In Canada, in 1998, our first code of practice that was dedicated to equine came out. And it was a good job for the era, but it wasn't specifically evidence-based. And so many people have described it as more of an opinion-based development. And so there was a need over time for that code to be updated and to be evidence-based. So in 2013, the Code of Practice for the Care and Handling of Equines came out. This was a huge step forward, in my opinion, a great accomplishment from the group. It received international praise, and we need to acknowledge Equine Canada's leadership on this initiative. They played a major role in helping to move this forward. So it was a partnership of Equine Canada and the National Farm Animal Care Council. So these are now nationally developed guidelines for the care and handling of horses. They serve as our national understanding of animal care requirements and recommended practices. And the codes promote sound management and welfare practices for housing, care, transportation, and other animal husbandry practices. So this particular code is a scientific committee was formed to help with this. It is evidence-based and consensus-driven. So the result, we now have a science-based and consensus-based code of practice. And I'll just quote from Dr. David Fraser, a well-known professor from UBC. His comment was, "I like the code development process. I like its emphasis on outcome-based, environment-based, and process-based measures. I think this is a good balance that hasn't always been captured in processes elsewhere and at other times." So it truly has been remarkable to bring it forward. So what's included? First, the science committee looked at the previous code. They gathered the newest research findings on equine care, health, and welfare, and they identified these areas of priority to be covered. So duty of care, facilities and housing, feed and water, health management, feedlot management, husbandry practices, reproductive management, transportation, change or end of career, and euthanasia. So some of these ones I will go through tonight. I don't have time to do all of them, but we will be having our other speakers talk about other aspects of them. The important part of this new code, and a great improvement on this, is the distinction between requirements and recommendations. So you'll notice that it's color-coded sections. They draw your attention to the requirements, and this is for minimal standards, but best practices are also included here with reasons for trying to do better and why we should try and do better. So this is helping to promote a stronger welfare standard for the country. So let's look at a few components of that code. One of the major ones is body condition scoring. So body condition scoring is a way to assess the status of the horse, the fat cover on the horse. And again, now we have some actual actionable items that are ascribed to the body condition score results. So it is recognized too that a horse that's too fat is just as much a welfare issue as a horse that's too thin. It also recognizes that old horses may get thin, but steps need to be taken to investigate the reason. So commonly dental issues, parasites, inappropriate nutrition, competition or lack of resources. So the key here is requires intervention. It cannot be ignored, and it certainly can't be accepted. So the two pictures at the bottom here, one is a 36-year-old horse still being ridden out on trail rides, looks, in great body condition, versus a 25-year-old horse where the owners said, "He's old, what do you expect?" So according to our code now, those require intervention. One thing to all horse owners, I really encourage all horse owners to learn how to properly perform a body condition score. It's a major tool that you should have in your management package because it can prevent problems before they become serious. So we recommend keep a record of those scores over time, through the seasons and from year to year, because it's a great thing to keep track of on your horses. For anyone who's interested, that poster that you see there is also available for from Equine Guelph, laminated so it can be hung in the barn. All right, other new highlights. Behavioral considerations are now part of the new code, along with the 5 freedoms, and specifically used as a basis. So calm handling, reducing stress and anxiety, understanding that the horse is a prey species, training and handling based on learning theory is now included in best practices. So that's a big change, and it's a welcome change from my point of view. So handlers must be familiar with equine behavior and competent in humane handling techniques, either through training, experience, or mentorship. Horses must be handled in a manner that does not subject them to avoidable pain or avoidable injury, and specific space requirements inside and outside the barn are now part of those basic requirements. The horses must not be trained in a manner that subjects them to unnecessary pain or injury. Also included are some new things about water, shelter, space, and exercise. The let them eat snow approach for many places is no longer acceptable. There must be an alternate source of water for them. Shelter is now included in that code to protect horses from extreme weather. And then all horses are required to have some form of exercise or turnout daily. Space requirements for stalls inside and also for paddocks outside are also designated. And this includes special needs for, say, the broodmare, the foal. So those are specified in the code. And also there's some very specific things about mud control. We all know how hard that can be sometimes, but essentially we must provide an area where the horses can get out of the mud during the day or night. Other new highlights in this code include hoof care, lameness, and dental. So specifically, the feet must be trimmed and or shod as often as is necessary to maintain hooves in functional condition. So the recommendation is every 5 to 8 weeks as needed. Lameness must be addressed. It can't be just accepted and turn the horse out to pasture. So it has to be addressed through specific therapies or a change in management or workload. Another addition is dental checks. They must be performed for horses showing signs of dental issues and can only be done by a vet or with vet supervision. Also some highlights: pain control, the veterinarian client-patient relationship, pre-purchase exams or investigations, and tail docking are also new in our code. So the veterinarian client-patient relationship, or the VCPR, is included as a best practice, but records or receipts of treatments provided must be available. It also specifies that all horses must be on a parasite control program and in consultation with your veterinarian. Specifically, laminitis is brought forward in the code, and it designates that lifelong care for laminitis must be included in the management. Pre-purchase by a veterinarian for the designated use of the horse is also a recommendation. And while a bit controversial, it now includes in our code that there's no tail docking for cosmetic reasons. Others there include reproductive management, responsible breeding, care of pregnant mares. Donkeys are included in this code, by the way, just in case you're wondering. They are included under equine. Foaling practices, care of the foal, weaning practices. There's lots of health information there about what are the basic health parameters for mature horses and foals. And then in the final part of the code, there is a section on transportation and decision to transport. So it talks about whether we can transport lame horses, downed horses, various other forms when horses are pregnant. And it also provides a decision tree in the back of the code. And new as well is the change or end of career options. So many of us know or have senior horses. There's more senior horses now than ever because many of us are keeping our seniors well into the retirement years. And so looking at a change of career or the end of career options is also something that's very important. Euthanasia is the last chapter. I'm not going to mention anything more about that because Dr. Bobsien will be talking about that. So these are just some of the highlights. We don't have enough time to go into all of them, But what I would encourage all horse owners to do is take some time to review the code of practice, and we'll have the address up there, and learn how it applies to their own horses. And make sure that you are looking at those minimum requirements and trying as much as possible to take your horses to the level of best practices. I'd also recommend that all horse owners take a course on the code. And I'll talk to you about that in a minute with a certificate, because one of the things that is difficult in this day and age is we need to put ourselves in a different place for the competition. And that's one of the things with COVID-19 is reinventing yourselves so that you can take your business and thrive as well as survive. And if you're able to prominently show that you support the code of practice as one way to differentiate yourself, this brings confidence to your customers and also helps support our social license to operate when we are using horses for business. So where can I learn more about this? What I would suggest you do is consider yourself always the student. No matter how long we've been in the horse industry, there is always much more to learn. So here's a couple of ideas. Equine Guelph offers a free tool for the horse owner. It's called Key to the Code, and you can find that on thehorseportal.ca or on Equine Guelph's website under Horse Owner Tools. And that helps you peruse on your own a link to the code, the scientific committee reports. There's quick access to self-checklists to go through your own management to make sure that you are on the code. And there's many other useful resources that you can find there too. We also offer the Horse Care and Welfare course that is based on our new code of practice. There's lots of other resources there, learning activities, self-assessment. There's guided experiences with an instructor as part of the learning community, multimedia approach, discussions with your peers, and then a certificate of completion at the end. The next offering for that is spring 2021, and we invite you to join the learning community. And for those of you in Canada, if you are a member of your Equestrian Federation, you get a reduced fee in order to join any of those portal courses, because all of our Equestrian Federations are our partners as part of the Horse Portal. There is also another option for people. The Horse Welfare Alliance of Canada has a free training site for horse owners to learn about the code of practice. And again, they provide lots of resources there, and you can take that for free, or they also have a certificate that you can take along with that. So that brings me to the end of my presentation, and I'd just like to say thank you to everybody for joining us tonight, and here is my information.
Thank you, Gayle, for such an informative presentation. The students of the equine management major would like to present Gayle Ecker with a certificate of $50 made in her name to For the Herd. Thank you, Gayle, for your time to be with us this evening.
My pleasure. Thank you.
This year, the Equine Industry Symposium has chosen to support For the Herd, an emergency fundraiser administered by Ontario Equestrian to assist riding schools that are struggling to provide for their horses due to the loss of revenue from lessons and camps due to COVID-19. All proceeds raised will go towards riding school facilities and their schooling horses across the province. For more information and to donate, visit the website www.fortheherd.ca. Every donation made in your name, a raffle ticket will be awarded to you for this year's symposium raffle draw that will be running at the end of this week. For the second speaker of the evening, I would like to introduce Dr. Roly Owers. Dr. Owers is a qualified veterinarian surgeon and has been chief executive of the charity World Horse Welfare since 2008. He graduated from Cambridge University in 1992 and acquired his master's degree in nutrition from the London School of Hygiene and Tropical Medicine in 1997. His previous veterinarian roles included the Blue Cross and the Royal Army Veterinarian Corporations. Dr. Owers plays an active role in much of the world's horse welfare's work, supporting the horse-human partnership across 4 continents, including leading the charity's work with veterinarian universities and networks, the UK government, the EU, OIE, the FAO, and the United Nations. He also advises the International Equestrian Federation and the British Horse Racing Authority on horse welfare. Dr. Owers is currently treasurer of the British Equine Veterinary Association, chairman of the UK Equine Disease Coalition, a director of the British Horse Council, and a board member of the European Horse Network. I would now like to pass the floor over to Dr. Owers to touch on the actual meaning and evolution of welfare, the 5 domains, and as well as key management and the comparison of global norms to global standards.
Rachel, thank you very much. I'll just start by sharing my screen. And I'd just like to thank the University of Guelph and all the organisers, including the Canadian Equestrian Federation, for inviting me to speak this evening. It was a great pleasure to do so. And what I've been asked to focus on is around maintaining equine welfare through COVID-19 restrictions. And I'm acutely aware that obviously what those restrictions were, and potentially will be, vary considerably from within different countries, across different countries. And so hopefully some of the things I'll talk about today will just give some general perspective on that. So in terms of the next 20 minutes, I wanted to just talk very briefly about what World Horse Welfare is, the organisation I work with, to reflect, very much picking up on what Gayle has just talked about, to reflect what we mean by welfare and equine welfare. Then to focus a little around what options we have for managing our equines under restrictions, which many of us have faced over the last few months, and some are continuing to face. What options we have given the sort of the financial repercussions of the global pandemic, what options we have around cutting costs, because as we know, looking after our horses is not cheap. To then focus, and in many ways a segue into Bettina's presentation, just to focus very briefly on what we mean by quality of life before trying to pull that all together. So in terms of World Horse Welfare, we're a charity that's been around for nearly 100 years, and at the heart of what we do is to support the horse-human partnership. We often think about a dog being a man and woman's best friend. We would often say actually the horse is a man and woman's best friend, because that relationship has been built up over millennia and is as relevant today as it ever was, through sport, through leisure, through working animals, through farm animals, through animals used in therapy, and a growing array of other ways that we have an involvement with horses. Today we work across 4 continents, as displayed on the map, and our current workforce is around 120 employees, and our turnover is in the region of 17 million Canadian dollars, and it gives you a perspective. And Rachel's just talked about our involvement. Unfortunately, when you look at international development, it is the world of the acronym, and therefore the OIE, which is the International Centre for Animal Health, the European Union, the United Nations, the Food and Agricultural Organization, unfortunately all become acronyms, which can become very confusing. And as also Rachel mentioned, we work very much in the area of horse sport. So just to put that on a diagram, just to try and give some perspective to what World Horse Welfare is about, there are 4 key areas of our work. Our founding areas around humane transport and equine slaughter. A key focus today is around responsible ownership and recreational use of equines. We've talked about, mentioned briefly about the responsible use of horses in sport, but also it's extraordinary to think that there are 110 million working equines in the world today, supporting the livelihoods of around 750 million people. So they have a very important role to play, literally as horsepower. And in terms of how we try and achieve those goals, it's through a number of different activities: caring, researching, educating, and influencing. As I mentioned, we do have an association with horse sport. As Rachel said, we have an involvement with the International Equestrian Federation and the British Horse Racing Authority in the UK, but also informally to other national federations. And for example, the year before last, we reviewed the German Equestrian Federation's welfare rules and regulations. And so that obviously that's a really important part of underlying responsible horse sport. So that gives you a reflection on what, hopefully very briefly, world horse welfare is all about. Very much picking up on what Gayle has mentioned just previously in her presentation. What do we mean by equine welfare? And I think to date, when people think of welfare, they think of their physical welfare. But actually, when you look at the definition of welfare in the dictionary, it is around physical and mental health and happiness. So it's physical welfare, but also mental well-being. And as Gayle has already talked about, what we need to focus on is not providing our horses just with a life worth living. It's around giving them a good life. And what do we mean by that when we talk about a good life? Because I would suggest that whilst the 5 freedoms, as Gayle has talked about, developed in the 1960s, has a profound impact, especially on farm animal welfare globally over the last 50 years. In many ways, we believe actually the 5 freedoms have served their purpose. They are now, we have moved on from them. And the reason that we've moved on from them, because when you saw the list that Gayle talked about, it is not enough to simply talk about avoiding negative experiences. And Professor David Mellor in New Zealand has been very active in this area, and the overall objective is about, as Gayle says, our animals, giving our animals opportunity to thrive, not simply survive. And so David Mellor and his colleagues have brought up from the 5 freedoms to move to the 5 domains. And here it is an advancement, because it talks about the 4 sort of physical or functional domains around nutrition, environment, health, and behavioral interactions, but how all of those collectively feed into the mental state of that animal. And collectively, that then creates the welfare state of that animal. So it's as much about providing positive experience for our equines as it is about avoiding negative. And therefore, quality of life, when we think about quality of life, we've got to remember it's based both on physical welfare, but also mental well-being. And we've got to move to a position where the mental well-being of our animals is as least as a priority as their physical welfare. And I think for many, that can be sometimes a challenge. A different way of viewing that welfare requirements is to think about where equines have come from an evolutionary point of view, and at their core, freedom, friends, and forage are what equines require. Because if we remember where we've brought them from roaming the plains in herds, and therefore they had the freedom to move. They were in social groups; they are social animals, and an equine would normally graze and forage for 17 hours every day. And so those 3 F's we need to really think around what that provides for them physically, but as importantly, what those 3 F's provide for our equines mentally as well. So when we move on then to think about COVID-19 and the restrictions that have been imposed on people across the globe, clearly it is vital that we have to meet the needs of our horses during any restrictions. And certainly from a European perspective, I'm not so sure about from a North American perspective, but certainly from a European perspective, this did create great challenges, because back in March, there was a significant challenges for equine owners to access their animals. In many parts of Europe, including the UK, many horses are not kept at home. They are kept in what we call livery yards, in stables. And so they're away, and that involves traveling. And of course, traveling is a risk factor when we are trying to maintain a pandemic. It's widely recognized that traveling is a risk factor. And therefore, when we are looking after our horses, we do have to act on the core message messages of trying to restrict the spread of COVID-19. And that is, in the UK, we talk about hands, face and space, the importance of washing our hands, the importance of covering our face, and the importance of social distancing, keeping at least 2 meters apart. And as we look after our horses, we cannot these aren't compromised. We can't compromise care of our horses, but equally we can't compromise on the public health messaging that is so important to controlling the pandemic. So obviously, when the end of March, or in the UK, it was the 23rd of March, and it was different dates in different countries, but there was suddenly a dramatic change in our ability to travel, to move, and therefore it really did create a real challenge for how we manage our horses. Giving again an example from the United Kingdom, but there was a real push in the UK in the initial part of the outbreak to protect our health services and not to try and put any additional pressure on our health services, because they were managing and preparing to manage the pandemic and its health fallout. So World Horse Welfare's recommendation for the first 4 weeks of the lockdown and the restrictions was not to ride our horses, because by riding, clearly there is a risk of falls, and there's a risk of actually having to go to use emergency services, accident emergency services. And we felt, along with many others, that we needed to reduce that. So we were making great challenges on us as horse owners, because the golden rule with making management changes is to make them gradually, and therefore it was a real challenge to, if you can't exercise your horse regularly, then often it's better to be able to turn it out to grass. And of course, we are very lucky in the Northern Hemisphere, is as the pandemic really took hold, we were coming from into the spring and then into the summer. So the ability to turn horses out to grass was there for a lot more people than if it had been in the winter time. But of course, the other aspect is that we do need to recognize that, while we'll always say one should never anthropomorphize our horses, they are not people, they're horses, and their requirements are different. But where there is a similarity is horses are individuals. And so what works for one horse might not work for another. And we need to be very mindful of that one size, most certainly, when it comes to changing management and the routines that we put our horses through, that one size does not necessarily fit all. Again, in the early part of the pandemic, actually getting access to routine healthcare was a real challenge. Most vets and a lot of farriers only provided emergency sort of call out facilities. But very quickly, working with government, we managed to establish, especially for equine veterinary practices, which are very different to small animal practices, which are generally indoor. Most equine veterinary work is outdoor, and therefore we were able to work with government to be able to establish protocols where routine veterinary and farriery and other care could be undertaken. But what it has done, and there are, I mean, as tragic as so much of the story of the pandemic has been, there have been a lot of learnings, and there will definitely be opportunities to improve the way we do things, how we just do our day-to-day, run our day-to-day lives. But also, an example here is, consultations by phone. What veterinary practices were often doing were trying to do that initial part of the consult that they would generally do face-to-face with the owner, to do it in advance, so they could plan for their visit and understand what they would need to do whilst they were there. And I think there is an element of that will be very good to take forward as we think of long-term sort of veterinary care. One thing we were very keen to sort of emphasize is that, it does horses no harm to have a rest. And especially when there was no competition, there was no ability to get out, actually giving your horse a few months off, or even giving it a year off, it is not necessarily any bad thing. And also, of course, there's different ways of doing things, so it's not always a requirement to go out riding. There are many alternatives like lunging, long reining, walking out in hand, just to keep our horses ticking over and keeping their mental well-being as well as it can be in what are very challenging times. what was critical in this whole episode was to get people to contingency plan, because if you fell ill or if you had to self-isolate because you had been in contact with someone who had had COVID-19, then you would not, unless they were at your home, you would not be able to go to stables to look after them. So we very much do encourage a buddy system, so people could not everyone would have to go and visit their horse every day. If collectively you're on a stable with 5 other horses, then one owner could go per day, and rather than having 5 journeys, you've got 1, and that one owner would look after the 5 horses. But of course, that's something you can't plan for on the day when you can't travel. It's something you've got to plan for in advance. And what are the details that you have with your horse at the stables, such as, you know, its veterinary contact details and it's what it's fed and all of those kind of really important, any medication that it's on. So contingency planning in terms of how we manage our horses in COVID times is absolutely vital. So that's around equine management. Clearly, we know that the pandemic is having a profound economic impact. People are losing their jobs, and that impact is going to be felt for many months to come, and indeed years. And this is something that through the National Equine Welfare Council in the UK actually was work that was done back in 2008, 2010 in the wake of the financial crash then. And obviously there was a huge economic impact from that. And there are ways basically of being able to cut costs of looking after our horses or caring for our horses. Sorry, not caring for them, cutting costs in terms of managing them, but not cutting costs to limit their care. And, you know, there are different ways. Certainly, for example, if you are limiting a horse's exercise and you're roughing it off and turning it out to grass, then its feed requirements are considerably less. There are ways of going into horse share arrangements. If you want to share the cost, you can think about grass livery as opposed to full livery, if that's an option. And working together, as I've talked in the contingency plan, it can save costs, not least in petrol costs if everyone's having to travel to stables every day. So there are a number of ways of thinking laterally. And that last one there, you know, if you go into many equine feed rooms, you will find a whole litany of additives and feed additives that horses are being given. In reality, what horses need are decent forage and any balancer that goes outside that. There's not much they need, especially if they're on maintenance care. They're not being in active competition. So we would always suggest that people resist marketing, because you can spend a lot of money on additives that have questionable benefit. But clearly, if you can cut back on some costs, as I said, you can't cut back on others. And preventative healthcare is probably the nub of it all, around vaccinations, around dentistry, around farriery, around, as Gayle says, you know, parasite care and management. You know, these things that you can have a profound impact if you don't manage them properly. And so it's certainly not something to cut back on. Then coming towards the end, obviously now we are going into the winter, and you know, I'm a lightweight. I live in the UK. -5 is cold for me. I appreciate when you're in Canada, that's a warm winter's day, but we are seriously going into winter, and that is a more challenging time for our equines. There are additional expenses, but there are additional health concerns and land management issues as well, and that's where quality of life is even more important. So quality of life is something that we are talking more and more about from a human perspective, but it's as important for our equines as well. And quality of life is what underlines to be able to give our animals a good life. And it's often something people think about when it's at the end of a horse's life, in its latter days, but actually it's as important from birth all the way through. It's something that we need to be better at measuring objectively. And there's a lot of work that's going on in this area, but it's still very much in its infancy. But what we always say is one should always base decision makings on quality of life for animals and not the quantity of life. And that goes to the heart of responsible ownership. And I know Bettina is going to talk about rehoming in a moment. And the worst thing to do is to try and pass a problem on. You know your horse best, and if in conjunction with your vet the decision is that the kindest thing to do is to put that horse to sleep, to euthanize that animal, then that is the decision that should be made. So I hope I'm in time. I haven't had a bing bong yet, but just coming to the final messages, I think what are they? We need to consider our understanding of equine welfare is changing all the time. It is advancing all the time. And it's really important that we keep ourselves up to date with that. So then when we are talking about and thinking about how we manage our horses, that we can make changes. And it's all about, as we often say, it's about challenging the status quo. Just because we've managed our horses this way for eons doesn't necessarily make it right. When we're thinking about having to make changes in a COVID environment or any other environment where changes are required, we need to, as far as we can, make those changes gradually. But also, as I said, horses are individuals, so that bespoke, make it individual to each of our horses. What works for one might not work for other. It is essential in these times to always have a contingency plan. And it's not just in a pandemic time. It is a time when, for whatever reason, you are not able to get to your horse and that something happens to your horse. It's really important to have a contingency of what might happen there. There are various ways that we can curtail the costs of looking after our equines without compromising their care, but that clearly needs to be done very carefully. And what we need to get much better at doing is utilising quality of life assessment to drive decision making at all stages of our equine's life, because it is the primary sort of tenet of responsible ownership, to give our animals a good life and a good death. On that rather somber note, thank you very much for listening, and I look forward to any questions after Bettina's presentation.
Thank you, Dr. Owers, for staying up into the night to give such an informative presentation. As a thank you for being here this evening, we would like to present you with a certificate for $50 made in your name to For the Herd emergency fundraiser.
Brilliant, thank you. That's great news.
Before I introduce the last speaker of the evening, I have a small public service announcement to share with the Equestrian Canada certified coaches joining us tonight. By attending the Equine Industry Symposium, you can claim 1 updating hour for every evening attended towards maintenance of your certification. Information on where to find and submit this form should be currently present on your screen. And it can also be found on our Facebook page at 202 EIS and our Instagram page at Equine Symposium, which will be available to view at the end of this event. It is with pleasure to now introduce our third and final speaker for the evening, Dr. Bettina Bobsien. Dr. Bobsien is a practicing veterinarian with a lifelong passion for both animal care and animal welfare. She has a Bachelor of Science in Agriculture and is a diplomat of the American Board of Veterinarian Practitioners, specialized in equine practice. She contributed to the development of the current Equine Code of Practice and was the chair of the Animal Welfare Committee of the College of Veterinarians of British Columbia. She works with both the BCSPCA and the Humane Canada on a variety of animal welfare issues. Dr. Bobsien is currently the chair of the CVMA Animal Welfare Committee and co-chair of the Equestrian Canada Health and Welfare Committee. She actively advocates for horses that are unwanted or at the end of their careers by engaging in public education on the matter. Bettina volunteers with veterinarians in Cuba while continuing to practice in the Vancouver Islands. I would like to now hand it over to Dr. Bobsien to discuss the importance of responsible decision-making, horse retirement, recognizing pain in horses, and cost and practicality of various end-of-life options.
Good evening, everybody, and thank you very much for inviting me to speak tonight, and thank you also to Gayle and Roly for providing a nice segue into this final presentation this evening. I look forward to having your questions at the end and hopefully some lively discussion. So today we're going to talk about equine end-of-life planning. And what I'm hoping you can take away from this is ideas about the lengthening lifespan of horses in North America, the financial and care needs associated with looking after older horses, and end-of-life options for horses without willing caregivers. And I'd just like to start off by talking about aged horses and the condition of aged horses. And here's one of my favorite patients we recently lost, Brody, at age 34. And it's been mentioned before this evening, but I'm going to mention it again. He ain't old, he ain't thin, doc, he's just old is not an excuse. I have an entire practice of horses that look just like this. And I'm going to actually start with 2 case studies because I was a student long enough to know that how tired you get listening to people talk about stuff. It's way more interesting to talk about horses and situations. But before I present these 2 case studies, I just want to quickly mention the relevant legislation so you have a little bit of a framework when you listen to these 2 very contrasting stories about what happened to 2 horses in my world. One is from the Equine Code of Practice and the other is from the CFIA transport regulations. So in the Equine Code, which was actually very nicely presented by Gayle earlier, in the change and end of career section, the requirement, and that's a must do, is that the welfare of the horse must be of paramount importance when making change or end of career decisions. And that's actually quite a powerful statement when you think about it. Also, in and around transport, horses must be individually assessed for fitness for transport, evaluation for fitness of transport in the context of each trip. Like, is it a 1 hour or is it 22 hours? And unfit horses must not be transported except for veterinary diagnosis or treatment. The transport regulations, which were just recently finished and invoked in Canada, I'm just going to mention briefly about compromised animals, that they require special care to be allowed to be transported. So things like isolation, individual loading and unloading, and the fact that they can only be transported directly to the nearest place other than an assembly center where they can receive humane care or be humanely killed. So the first horse I want to talk about is Misty. Misty was a 17-year-old APPALOOSA pony. Misty had a long career of going from family to family, taught lots of kids to ride, some of them grateful, some of them ungrateful. And unfortunately, Misty, like many spotted horses, suffered from recurrent bouts of equine recurrent uveitis. Misty's family lived in a nice house and they drove new vehicles, and they were relatively well-heeled people in my practice area. And I dealt with Misty's recurrent, very painful episodes of uveitis, always with partial success because I really couldn't get the dedication to Misty's care that was needed to manage her chronic, very painful and blinding condition. And one day I happened to meet the owner of Misty in our local supermarket and in the dairy section. And she walked up to me and said hello. And I had difficulty remembering her, of course, because I only remember their horses. And she said to me, she said, "Do you remember that pony Misty?" And I said, "Oh, of course, yes. How's Misty doing?" She said, "You wouldn't believe it. I got $250 for that pony when I sent her to auction." And this is on Vancouver Island. So thinking that Misty was almost completely blind at this point, in pain, was at the end of her service to humanity. To think that she had been transported to an auction mart, had been sold with a group of horses, and then traveled a minimum of 20 hours to a feedlot in Alberta, left me considering doing something violent with my container of cottage cheese. This is the kind of transportation that Misty would have endured in a truck. And this is the kind of housing Misty very likely would have endured at her 6-month required washout period, because likely she would have traveled without a medical record and would have been in the feedlot for 6 months to allow washout of phenylbutazone and other drug residues. Second case study is Lucas. And Lucas was a successful warm blood jumping horse who was at a high-end riding school, had a very successful career, brought many young riders up through the ranks so they could purchase their own jumping horses. When Lucas turned 19, it was decided that the big jumps were enough and it was time to transition him to a new home. He went to a more rural riding school and started to jump 2'6", and then he started jumping cross rails, and then he started hacking and eventually was retired at pasture for a couple of years, during which time his arthritis gradually deteriorated, and very recently was laid to rest on the farm where he was retired. And there's a couple of things about this picture to note, and one of them is the leaves on the ground. That means it's fall. It means we're heading into the long, cold, wet winter, very, very difficult for these aging horses. The other thing to note is the two responsible owners for this horse that made that very difficult decision. And although he loved them, they loved him very much. And although, as you can see, he was still in very good physical body condition, he was in chronic pain. And so his owners made the decision to let him pass quietly on a sunny day. So what do we need to be thinking about in situations like this? I think we have to reflect on what's best for horses and what's best for horses at the end of a long career, and particularly a career of service to humanity. And just to summarize, here are our options. Retirement, either full retirement, ideally with turnout, or reduced athletic demands like our Lucas horse. Another option is rehoming. We're going to talk about that a little bit more. That is a risky business with a horse that's at the end of his career, because generally the person that needs to be financing a horse's retirement is the person that a person that at least had some enjoyment and of that horse throughout its lifetime. Euthanasia is another option, and we'll talk about that as well. And also in Canada, there is a slaughter option for horses. If we want to think about retirement, we really need to think about all of these factors. One is the cost, which we're going to go into in some detail. Also time it takes to care for an older horse, and then the medical management. So retirement, this is a bit of a reality check. When I was a young rider, which was a long time ago, but not that long ago, horses used to live around age 20, and typically horses at age 20 had terrible dentition. We didn't know how to look after their teeth very effectively. We didn't have all the specialty feeds that we now have. So it was typical for horses aged 18, 19, 20 to get thin and be given the last summer and then be let go, either for slaughter or humane euthanasia. With our current medications, our specialty feeds, and our dental care, horses now live comfortably well into their 30s. And one of my colleagues very aptly said, as long as we have horses, we're going to have retired horses. And when do horses retire? This is something that is rather breed and sport and discipline specific. Race horses and show quarter horses often have fairly short years, retired at age 5, 6. Many of them go longer, many of them go shorter. Sport horses, dressage, jumping horses, 10 to 20 years. Trail and ranch horses often work much longer. Some horses have health problems right from birth and never work at all. And in my experience, many ponies never retire. They literally die, half an hour after their last pony ride. So when you think about that, does that mean that horses can be retired for more than half of their lives? And I have to answer that with absolutely. And this is a photograph of one of my favorite clients who lives close by. This lady was actually born on the backstretch at Exhibition Park. Her parents were horse trainers, and she recently moved to Vancouver Island with her 3 aged thoroughbreds, all ex-race horses, all raised raced, bred, and raced and retired by her family, ranging in age from 21 to 29. So what does it cost to look after a retired horse? You know, basic care for most horses, as many of you will know, is in and around $20 per day. If you have acreage, maybe you can do it for less than that. You're probably not being realistic about it, but you can do the work for free. But a sobering thought is that a horse with no teeth or very poor dentition costs up to $16 per day for feed alone. That's a horse that's having to exist on beet pulp, pellets, all kinds of much more expensive processed feeds. Add into that, once the horse is over 20, decent chance that he's going to need some medication for an age-related disease, PPID, Cushing's. And as horses age on from 20, the statistic of them developing PPID that requires treatment goes up fairly dramatically. So that runs between $1 and $3 per day and more. Anti-inflammatories, as most of them are arthritic, glucosamine and other joint health products, $2 a day, and that's in addition to farriery and veterinary costs. So here's the time for the scary math. If on average, many horses retire from active work at around age 15 to 20, that means that their retirement can now last for 10 or more years. So if we think that basic care plus one medication is $630 per month, that's $7,500 per year minimum. And there are many, many costs in addition. Emergency veterinary visits, specialized farriery care, the list goes on and on. So for your average 10-year investment, or 10-year retirement, excuse me, that could be a minimum of a $75,000 investment. That is a tremendous amount of money. The other big commitment here is time. In general, the time required to care for horses properly is often underestimated, and aging animals often require more care, specialized housing, daily medications, specialty feeding, soaking their feed, treating them for mud fever, treating them for rain scald, getting them indoors earlier during inclement weather. It all takes extra time. The other consideration with retired horses is medical care. Many horses that are retired or older suffer from chronic pain. And one of the things we're learning now with a lot of the new information in and around facial pain recognition scores and so forth is chronic pain is frequently underestimated or unrecognized by owners and caregivers as prey animals, as horses are prey animals, and they're very, very skilled at hiding their pain. And frequently, these horses are actually, they may have multiple lameness issues. So they may be lame on all four legs, which makes them walk stiffly, but it's actually just because they're lame on all four legs. And sometimes a long retirement is just a retirement in chronic pain. And that really could be a poor welfare decision for that horse. So another option, if you can't afford to care for your aging horse or you don't have the capacity, there is the option of attempting to rehome him. And this is a horse in my neighborhood that came up on Facebook. You know, we're looking for retirement home. This horse was 33 years old, had no teeth, and had a body condition score of about 2.5. And the idea that somebody would try to rehome this horse, in my mind, is absolutely appalling. Of course, the reason I found out about it is because one of my lovely farrier clients took this horse on and actually had me go and do a pre-purchase examination on him, just so I could give her an estimate of how much it would cost to care for him. And I gave her that little talk and she promptly took him home. And he lived for about 2.5 years in her care and did really, really well. But that lady is an outlier. And what do we do if we can't care for the horses adequately? There is no bad welfare associated with a timely euthanasia, but there is terrible welfare associated with people pawning off their old unwanted horses onto unsuspecting horse lovers. And that's the standard, free horse on the internet. I just find that absolutely appalling to see that. And this is a really shocking case. And this was a 27-year-old Arabian horse that was a free horse on Facebook or social media or whatever. It was adopted by a couple of men in Victoria who promptly starved it, and after multiple visits by the SPCA, decided to euthanize this horse themselves by hanging it. And they managed to escape cruelty prosecution because the judge couldn't be convinced that the horse didn't suffer when it was hanged as a method of killing it. Just an appalling case. We have another emerging problem, and it's what I refer to as overhorsing good owners. And this is as a result of social media campaigns. We have some well-meaning people that are trying to save horses that are at the slaughter auctions. Many of them are at the slaughter auctions because they were quote unquote retired. So well-meaning people adopt these low-value animals despite the fact that they already have as many horses as they can properly care for. And as a result, welfare of the whole group of their horses suffers because they're burned out, they're tired, they can't afford all of these horses that they've taken on, many of whom are high needs. The other concern about taking these horses into your herd is severe biosecurity concerns. These horses are rescued from auction, so many of them may be carriers of diseases such as strangles, EIA. I haven't seen a Coggins test pre-transport yet. Most of them are behind on vaccines because they were animals that were not really valued anymore. So this can have devastating or fatal consequences for the entire herd. We need to stop this, okay? This is an old Robert Frost quote. It seems that passing off horses is a cultural tradition and it needs to stop. Third point, euthanasia, things to consider. Ethics, yours and those in your horse area social circle and veterinary care circles. Not everybody is going to agree with a decision of euthanasia. Finances, it does cost a little bit to euthanize a horse and have it disposed of, but in most cases, no more than caring for it for a month. Definitely quality of life, especially around chronic pain. And also you need to make sure that you obey contractual obligations. Some rescues will not allow you to euthanize a horse that has been in their care, and some people won't allow you to take it to slaughter. There are also changing attitudes towards horse retirement versus slaughter. Back in this lady's day, all old horses went to slaughter, racehorses went to slaughter, no longer the case. You may also run into problems with a veterinarian. There are many veterinarians now that will not consent to euthanize an animal unless it's clearly in critical distress. Last issue, horse slaughter. We know that there are very, very strong advocates against horse slaughter in Canada, in North America, and there's plenty of issues around auction barns, transport, and handling in feedlots around the slaughter process. So in conclusion, horses can and do live much longer than their athletic careers. If you can afford and choose to retire your horse, and if your horse is doing well, it's obviously ideal. But we can't expect all owners to have the resources to retire horses at their end of their career. And doing the dirty work of arranging euthanasia is the responsibility of owners and industry, not rescues or animal welfare agencies. Maybe we need to rethink the horse slaughter idea, the European model, small abattoirs in areas of horse concentration. Hold industry more accountable, develop a relief fund by federal and provincial horse associations to support end-of-life costs. Educate, talk to people about this, encourage end-of-life planning by horse owners. And last of all, be practical. It may not be affordable or humane to retire them all. Thank you very much, and I hope I haven't gone too far over time.
We would like to present you with a certificate of $50 made in your name to the For the Herd fundraiser. Thank you for taking the time to share your expertise on this topic.
Thank you very much.
We have now come to the question and answer portion of the evening. If any attendees have questions for any of our speakers this evening, we invite you to type your question into the question and answer section found by hovering over the lower portion of your screen to the bar located on the Zoom call and clicking on the question and answer icon. We will be monitoring the questions over the next few minutes to get through as many as we can.
The first question listed here is for Roly. What advice can you give to national equine sport organizations about the development and implementation of rules and regulations that are outcome-based and animal-based to improve the welfare of horses in training and competition? There are many instances where prescriptive rules are not good enough, but training and education of competitors and officials on outcome-based rules is very challenging with current lack of animal-based indicators required for reliable compliance assessment.
Well, thank you. It's a great question. Absolutely. In terms of what advice can I give, I mean, I think federations need to be open-minded, because whilst there has been a lack of reliable measures, that is rapidly changing. Over here in the UK, Sue Dyson and her work around behavioural ethograms, actually reliable ways of assessing musculoskeletal pain in our horses through behavioral indicators like the swishing of the tail, like the position of the eye. So it is an evolving area. It's still in its infancy, but it is beginning to change. I think some of the work that Sue has done, shows that 47% of horses, sport horses, so these horses, and some being ridden at a high level, are lame. And therefore, you don't need significantly sophisticated measurements there when you've got horses that are lame, and therefore through a veterinary assessment, veterinary trot up, we could be doing better. But I think the key thing is to be open-minded, because as I said in my talk, our understanding around equine welfare is evolving all the time, and our understanding about equine behavior is equally, and how we can read what our horses are trying to tell us. So it is very much an evolving area. Education is really important. Clearly, the people who know their horses best are the owners and the riders of those horses. So if rather than bringing them to competition lame, they don't bring them at all until they're sound, that will obviously be a huge advance. But I think something that, final comment, is what Gayle mentioned in her talk, was around social license. Unless we do better, horse sport won't have a very bright future if people think, for example, lame horses are being competed. They will not think that's right, because it isn't. It's absolutely wrong. So there's a number of different pressures, not least the ethical one, to why we need to be doing better in this area, and actually responding to the science and the research, and investing in that research.
Thank you for that answer. The following question is for Bettina. What are your thoughts on refusing euthanasia of a horse who does not need to be euthanized? Could this not pose another welfare issue if the owners then choose to not care for the horse?
So I'm not sure I understand so I believe the question is, if a veterinarian declines to euthanize a horse for an owner, does that put that horse at risk of lack of care? I believe that's the question, and I think you're absolutely right. That is a really serious concern. And as I do encounter people that approach me to ask me if I will euthanize a horse that's at the end of its career, and they have been refused that option by 2 or 3 veterinarians ahead of me. And given what I have seen, I will consent to euthanize a horse if it doesn't have a willing owner. I have been approached by people over the years people that want me to euthanize a horse for reasons of poor performance, where I have looked at the horse and it's clear to me that it has a management problem, that a medical management problem that could be managed by a caring owner, or has a training problem that could be helped by a competent trainer. So I have showed up at euthanasias, picked up my cell phone and called some of my helper people in the community that are prepared to just drive over, pick a horse up and try to help it, with the understanding that if we can't get the horse rehomable to a reliable home in a reasonable amount of time, that we will proceed with the euthanasia. And I've never had a client refuse that. Frequently they're just at the end of their rope, either financially or emotionally or whatever, and they will welcome that kind of intervention. So I hope that answers your question.
Thank you for that comprehensive response. The following question isn't listed for a specific presenter. It is on the topic of COVID-19. COVID-19 has obviously had a massive impact on finances. What would happen if someone was no longer able to maintain their horse's welfare? I imagine selling a horse at this time could be difficult since everyone is trying to cut costs.
I would be delighted to comment on that. Horse prices in my part of the world are through the roof. There's no horses to buy. Everybody's talking about staying at home. So I, like many people, had anticipated that I would be unemployed by now. And like many veterinarians, at least out west, everybody went out and got a puppy and a pony. So there is no shortage of homes for horses in my part of the world. I'd be interested to hear what's going on back east.
I can certainly say from a UK perspective, Bettina, it's exactly the same. It has greatly surprised us, the fact that for the leisure and sort of low sport horse market, you know, what animals that were selling for 3-figure sums are now selling for 4-figure sums. And so it has been a benefit. I mean, we still believe that going into the winter, there's going to be a pretty grim consequence of the pandemic and the economic fallout. But I think one thing that's really helping the moment is the fact that the market is strong, and so long as in this example, as long as the animal was fit and healthy, and that wasn't being sold on having sort of as Bettina said, sort of shrouding problems, then that is obviously a genuine possibility.
All right, thank you for that answer. The following question is also not listed to any specific presenter. It reads, here in Alberta, there is a local company that will euthanize and take a horse away, not vets. Is there something like that? And is this available in other provinces?
I can, I'm sure Bettina would want to comment, but just from a UK perspective, yes, it's a rather unfortunate term we have over here. They're called knackermen, and they come and they will euthanize the animal and they will take it away. And then we have rendering plants, so there's all sorts of products that from an equine carcass can be generated. And the key for us is, you know, when a horse is dead, its welfare is no longer of a concern, and therefore, so long as the person euthanizing is qualified and does it humanely, then that doesn't necessarily in all parts need to be a vet. It can be a qualified knackerman, as we call them, and that, as long as it's done humanely, is absolutely fine.
We in the Lower Mainland area near Vancouver, exactly a similar kind of service. And the horses are dispatched either by shooting or by captive bolt, both of which is considered a humane end, and is less expensive for people than veterinary euthanasia and removal.
Yeah, if I could just add to that, I'm not sure that that service exists here in Ontario. I've not heard of it. We certainly have drovers and others that'll come and pick up a horse, but I'm not sure that we've got any sort of non-vet euthanasia happening on the farms.
Thank you. We have time for one final question. This one is directed towards Roly. Of the 3 F's, it seems to me that freedom is so important, but it is undervalued and overlooked in most boarding situations where all stalls are the premium and preferred option. How can we optimize outdoor board in the minds of humans and for their horses? What are the best practices for outdoor board?
It's a great question. I mean, I think the key to that is education, because there is a lot of misinformation, and the fact that when I talked earlier about anthropomorphizing, when it's cold outside, people want to bring their horses in and stick a rug on it. But actually, you know, from an evolutionary point of view, horses do quite well outside, and therefore there is a real need for education. There sometimes is a role for legislation. Gayle talked in the Code of Practice. Obviously, that's not legislation, but that's a can be what is deemed to be good practice or basic practice. In countries like in Denmark, in Switzerland, there is a legislation that all horses do have to have some turnout time. But obviously, the drawback of legislation is someone's got to enforce it. If we can actually get people to understand better what the importance of having some turnout time, and of course, horses in different contexts, you know, some horses are kept in towns and cities, in riding stables, and obviously their ability to get out to pasture is very limited, but it still means turning them out into a sand paddock during the day can give them the opportunity to stretch and have freedom and roll and express normal behavior. So it obviously is dependent on the environment which a horse is kept. And in terms of, I think there was talk about, you know, what are the best practice, it is, you know, those slow gradual changes. You don't have a horse that's very fit and then you turn it out in when it's -20 without a rug. It rather depends on making any changes gradually and managing that and listening and watching your horse react to how it is in that environment. But I think in terms of the base requirement there is around education and greater awareness of the importance of horses to have the freedom for turnout.
Thank you. It appears we have time for one final question. Continuing on the non-shortage of horses in some areas, do you expect a horse dump once COVID starts to recede, sort of like the Easter dump of rabbits?
That's a great question. One of the interesting things about COVID, the social things and changes around COVID is that it has been so unpredictable. My guess is no, because I have a lot of people that are really, really enthused getting back into riding and have kind of put travel and a lot of the other things that they were formerly envisioning themselves doing when they were retired kind of backburnered, and they've gone back to wanting to do things closer to home. So I'm optimistic that maybe all of this is going to cause a bit of more of a societal slowdown, and we'll get back to focusing more on our animals and our home and things closer to home. But that's just a guess.
I would certainly echo that, Bettina. I think there's two very separate issues here. There's the financial fallout of the pandemic, and we do have grave concerns around what that might mean going forward. But I think World Horse Welfare in the UK, we rehome animals, and all charities over here have found, picking up on Bettina's point, you know, we've rehomed more horses, despite the fact that we were closed for 6 weeks earlier in the year, this year, than we have ever done before, because people have realigned their priorities. And they've decided actually their quality of life is really important, so they are going to get that horse that they've always put off getting. So when we rehome animals, we do sort of try and talk to people and get a really clear understanding of why they want to rehome, and our belief is that those reasons are very genuine. So that would echo what Bettina says. I don't think we are predicting that when the COVID recedes that we'll have this horse dump. but potentially when the economic impact really takes effect, there might be.
Thank you for all of your comprehensive answers. I will now turn the floor over to Rachel for our closing remarks.
Thank you, Erin. I would like to conclude this evening by thanking our guest speakers for taking time out of their busy schedules to join us this evening and share their expertise on the topic of equine welfare and how it might be impacted by the pandemic. As well as educating everyone on a vast topic, I can personally say I have a better understanding for equine welfare as a whole. Before I say farewell for the night, I would like to remind all attendees that there is an ongoing raffle during this year's symposium, which includes various discount codes to the companies listed on your screen. With attendance to each of the evenings of the week-long event, you are automatically entered into the raffle to win one of the prizes offered. If you had the chance to fill out our pre-symposium survey, answering some of the questions about the effects of the pandemic from a personal standpoint, another ticket under your name and email has been entered. Some of the amazing prizes include, but are not limited to, 2 $50 gift certificates to Brooks Feeds, a 1-hour trail ride at Conestoga River Horseback Adventures, a short online course delivered through Equine Guelph, and a coupon for $75 off a Tapestry Comfort Girth. A full list of prizes can be found on our social media platforms. Similarly, a feedback survey will be emailed to all participants at the end of the week. By filling out the feedback survey before Monday, November 23rd, another ticket for this year's raffle will be entered under your name. Good luck to all of those entered. The winners will be drawn on Monday following the week-long event and will be contacted by email. Please watch our social media pages for the ending results of the draw. Thank you to all the attendees for tonight's session. We hope to see some familiar faces over the next 2 evenings. On Thursday, we hear about the importance of traceability and emergency preparedness and concludes the symposium on Friday with the discussion of COVID-19, silver linings, and the positive aspects that have emerged from the pandemic. Thank you again for those able to join us tonight. We are so thankful to have so much interest in the Equine Industry Symposium. Keep an eye out on our social media each Wednesday for the next 3 weeks following the symposium for additional information about the topic discussed this evening, or visit thehorseportal.ca for more on equine welfare resources.